Hello and welcome again to Health Matters on Channels Television. Thank you for staying with us. I am Mary Alale Yusuf. Musculoskeletal conditions are giving rise to huge healthcare costs and loss of work hours. That's according to the World Health Organization. Disability due to musculoskeletal disorders increased by 45% from 1990 to 2010. Arthritis, which involves bones and joints, is one of these conditions, affecting about 350 million people around the world. Of arthritic complaints, osteoarthritis is the fastest growing major health condition. It is more common with age and in women. With me on the show today is a consultant orthopedic surgeon and the head of clinical services at the National Orthopedic Hospital, Igbobi, in Lagos, Dr. Michael Ugbeyi. You are welcome to the program.
Thank you very much.
What does this osteoarthritis look like? Can you describe it?
I think, first of all, I would say arthritis is simply put inflammation of joint or joints. Osteoarthritis is a disease process, chronic disease process that affects synovial joints. Synovial joints are joints that are lined with cartilages. And so with osteoarthritis, I say it's a process chronic.
Yes, you say it's chronic, so it takes a long time.
So it's a gradual loss of the cartilage that lines the bones, the bone ends that form the joints. Usually you also find that in this joint you have production of synovial fluid that helps in the lubrication of the joint. So it's a complex process that can be preventable, and but it's also age-related. So there's there's degeneration, there's a loss of cartilage, there's an attempt at repair, and also you may have mild inflammatory process with it. That's the difference.
Let me get this straight now. You say it's loss of cartilage.
Yes.
The cartilage, is that where the synovial joint is?
No, the joint has a bone. Maybe let's say take the knee joint, has the cartilage lining the bone end, the femoral end, yes, and the cartilage lining the tibial end.
Okay, so and both bones have a little cartilage on them.
On both ends, and then you have some soft tissues, ligaments all around, and within the joint is a little fluid called the synovial fluid. Usually in the knee joint, it's not more than 5 mils, which is very little.
That's very little.
Where you now have arthritis, you might have what you call sympathetic effusion, in which the joint becomes, you have fluid collection in the joint, and then there's swelling and pain.
Okay, that's what's sympathetic. It's trying to make up.
Yes, something's weeping.
Okay.
Yes, yes.
Okay, now, I know that pain would be one of the symptoms of arthritis. What are the other symptoms?
Well, apart from pain, which is can be either intermittent or with late stage becomes all through the day. But associated other symptoms will include stiffness, early morning stiffness that gets better with movement and as the day goes by. Then you also have a situation that stiffness may have also muscular contractions. And then you may have associated swelling. And this swelling, you find that when that occurs, is worse when you are using the joint more. So more so if it's a weight-bearing joint like the knee, you can have a situation where the patient cannot walk. So pain initially that waxes and wanes, and with late stages it becomes consistently there. And sometimes you may now have associated, we call it systemic symptoms, in which patient may have fever and all that. It's not because it's a direct thing, but as a result of some substances that may be released into the joint.
Okay, we're looking now at this diagram. That's supposed to be a synovial joint, isn't it?
Yes, that's a typical
but
joint.
This bone looks like it's resting on the other bone.
No, this is just a diagram to depict what a normal joint will be like. What you can see there that is bluish is the cartilage. This is a bluish, the cartilage is uniform here. In osteoarthritis, what has happened is that there is wear and tear on the cartilage that is asymmetric. In other words, some areas are normal.
Some are slimmer.
Exactly. So it's a gradual process. But you see that when that relationship is when the bone on bone, when all the cartilages are lost, you now find a situation, those muscles and tendons around are very important because they give stability to the joint. So when you now have instability around the joint, what happens is that stresses are more, concentrated in one aspect of the joint than the other. This process also,
so that might lead to limping?
Yes, limping and all that. Because also, don't forget that once you have that situation, you have when there's instability, then there are other substances. It's a vicious cycle. Other substances are released into the joint that will cause pain. So apart from the fact that you have a bone and bone resting and rubbing on one another, you have the nerves around them that supplies the muscles and tendons around it. They also would cause some of these substances to be, and then it will cause pain.
Okay, obviously, osteoarthritis affects the knee. What